medicine, either in psychiatry, ENT, or dermatology. There's all sorts of different colleges you can specialize in. And I'm going to be starting in psychiatry from next February, but I started early as a psychiatry registrar. So it's been a bit of an interesting week. So I'm doing a locum position at the moment, which is kind of like an unaccredited registrar position. And because it's a locum position, it's really good because first, it pays better than a non-locum position. It does mean that it's not accredited towards your training formally, but that's okay because I'm in my residency year. And it also means that you're helping out a team that really needed an extra doctor because they had to put up a locum job. I didn't really follow the traditional pathway of finishing the full first 2 clinical years. I kind of exited residency a little bit early, which was a bit of a tense time. You know, I gave my notice and there was a lot of doctors flying in from the UK. So there was a bunch of other doctors, but still it meant that there was a bit of shuffling that had to happen for my kind of shifts that I wasn't going to work because I changed jobs. And I feel very guilty about that, and I'm sorry to anyone that had to pick up those shifts, and thank you. But also, they could have just hired a locum doctor to take those shifts. So anyway, I won't get into that. The point of this video is really going from residency to registrar. And honestly, right off the bat, I don't think that much has changed. I still run all my plans by a senior consultant. There's a bit more independence though. I'm left alone for a lot of the day. And working as a registrar in psychiatry is really interesting. It can be very full on, but I'm part of a very cool team. I think the most important thing in kind of doing any training program before starting as a registrar is you want to be good at emergency medicine. You want to be able to handle high intensity situations that require kind of urgent decision making and manage that stress and coordinate team responses to that stress. Because once you can do that, at least to some of the common emergencies, then you can feel more comfortable being alone. Because I mean, the worst thing that can ever happen is a patient dies in front of you, right? So it's really important, I think all doctors should do this, but you should do level 2 ACLS. So Advanced Care Life Support level 2. So the highest kind of certification for general doctors to do. And it just makes you really good at getting pads on someone's chest and defibrillating them quickly if they've died, and coordinating a kind of resuscitation response from a bunch of nurses and wards people and whoever is in the room, basically. And so I've just finished basically like 6 months of emergency medicine and the ACL and the Advanced Care Life Support training. So I feel like pretty okay. If someone dies in front of me, I feel like I know what to do. I hope that never happens. I hope I never have to deal with that situation. But if it eventuates, at least I'll know that I can give good quality care. Then the second worst thing that can really happen to you as a registrar, I feel like, is making a mistake. Okay, and that's going to happen. And the way to really avoid that, I think, is just running your plans by a senior. So just talking to the consultant psychiatrist and letting them know what your plans are. So what does my week look like? So I'm part of a community mental health team, which means I take care of people who have just come out of hospital or people who might need to go back into hospital but aren't quite there yet. So we're trying to prevent the admission. And also taking care of people with mental illnesses that need ongoing care, but are too complex for a private psychiatry or a GP to manage. So I've been seeing many patients with kind of severe treatment-resistant chronic schizophrenia, psychotic depression, bipolar disorders. Those are kind of the big 3 that I've seen this week. And I've even been doing home visits, going to people's houses, talking to them in their own environments. And it can be very confronting if they're doing drugs and they've got drug paraphernalia everywhere, or bongs and pipes and needles and things. And it can be dangerous as well if someone is paranoid and they feel like you're monitoring them, which in a way I kind of am monitoring them because I'm checking in to see how they're going, to see if there's anything we need to change in their treatment plan. Sometimes they might get violent, but I think it's really important to remember that really people with mental illness are much more often victims of violence than perpetrators of violence. That being said, if someone is paranoid and they think you're an aggressor or you've been monitoring them and been putting thoughts into their head, whatever the mental illness might make them think, there is a risk of violence for some people. So as a psychiatry registrar, you have to navigate that. You need to stay safe, stay closer to the door, make sure it's a nice open room. Don't make anyone ever feel cornered. But fortunately in the community mental health team, normally the people who I'm seeing have been managed for a longer, pretty long term, for months or years, or even decades. And so they're on a treatment plan that hopefully has stabilized their situation. So for me, for example, no one's been violent yet, so it's been pretty good. Don't get me wrong though, there are people who just don't want to talk to me because they don't like the mental health service and what it represents. And there's not really much I can do about that. The way I see it is we're just trying to make people's lives as good as they can be, and sometimes that means giving them medicines that have side effects, and sometimes they don't want these medicines and they're getting the medicines against their will, but usually that's in the case of them when they don't take the medicine, like an antipsychotic. If they don't take it, they usually become very unwell and are at risk of harm to themselves or others, or they have harmed themselves or others. So it's kind of in their best interests, but if you don't have insight, it's very hard to justify that, and it feels very paternalistic, but you only ever do that when there's evidence to suggest you need to be paternalistic, because sometimes you need to be paternalistic. But gosh, it's really making me appreciate just how much kind of philosophy and ethics is involved in mental health. I obviously can't talk about individual patients and their stories because, I've got to maintain everyone's confidentiality and keep that trust. But I can just say things like, it's really interesting just to see it's really interesting to see how the same mental illness has such a different effect on different people in severity and how much it responds to treatment. So like one person with schizophrenia or schizoaffective disorder will have such a different experience to another person with a similar background, similar age, similar whatever. They can have two very different lives. And so I've seen some pretty good stories of people being functional in good relationships with jobs, contributing to society, feeling good. And I've seen sad stories of people who just, they're spending all day just listening to their voices because the voices are paralyzing them, and it's like, what can we do to stop this? And it's really hard. And I know I'm a junior doctor, I'm young, I'm probably a bit naive, but I also recognize there are people with just chronic psychosis that, no medicine will really improve the symptoms they're experiencing. It might improve the kind of side effect of the symptoms, like the anxiety that they feel from the voices. It might numb the intensity of the bad feelings a little bit. But yeah, there are people who just have really tough lives. And I guess I want to do mental health to just kind of make their lives a little bit better if I can. And not to go on too much of a tangent, but I guess just talking about all this makes me really appreciate the beauty in medicine and the beauty in caring for someone. Like, these people are strangers, I don't know them, but I can meet them and talk to them, and it's so interesting, this job of being a registrar in psychiatry and mental health, because within, half an hour of meeting someone, we can talk about their most deepest, darkest traumas and repressed feelings, and, well, technically not repressed if they're aware of them, but you know what I mean? Like, they can talk about all these things that they don't tell anyone else. So I'm really enjoying it. I really like it. I think it's a beautiful job. It's all about the art of conversation and talking to people, and it's been a very good first week. I also work with a bunch of social workers and nurses and this and that, multidisciplinary team of people who have been doing it for decades, and just, they know the system, they know the game. They've given me really good feedback about my style. I still have a lot to learn about how to ask certain questions, how to bring up certain topics. I'm a little bit awkward with some things, and that's expected. But I'm going to read this book called Carl Latt. It's by Carl Latt. It's called The Psychiatric Interview, and apparently it has a lot of good pearls on how to conduct the psychiatric history. So what's next? Well, look, I've got this job till mid-January, so for the next couple of months, which will be nice to save up a little bit of money, and then we're going to move to Canberra, the capital of Australia, for next year, and see how we like it. We're going to move there. I've got friends and family there, so that's going to make it a bit easier. We're going to try it for a year, see how it goes. If the weather's too bad and we're not liking it, then we'll just come back to Sydney. And the Sydney house prices are ridiculous, even for a doctor. I think doctors make, good money, but usually it's later on. At the moment, it's pretty average. So yeah, I think if we live in Canberra and we can see that it's not really for us, it doesn't work well, then that's the justification I personally need to buy an overpriced place in Sydney, which will be overpriced because that's Sydney. So anyway, it's a bit of an experiment next year, but I've got a job in psychiatry there, so I'm very excited. I hope we'll like it. I hope I'll be there for a long time. We'll see how we go. But one thing's for sure, I'm going to keep making these YouTube videos. Anyway, that's it for this video. Thank you for watching and listening. And if you enjoy it and you want to support me, subscribe to the channel, all those good things. And I'll see you in the next video. Bye for now.